My name is Eric Chang. I'm a plastic surgeon. I practice here at Howard County General Hospital. The overdevelopment of the male breast is called gynecomastia. This condition can affect young boys in their teenage years all the way up to grown men. It can really affect a young man growing up. I see teenage boys who tell me that they don't feel normal in gym class. They might be great basketball players, but they're afraid to play basketball because they might have to play shirts and skins. I see young men who tell me they can't go to the beach because they, feel afraid to take off their t-shirt at the beach. Something like this can really affect a young man's life. Again, I've seen men who had weight loss surgery who have lost 200 pounds, and the one part of their body that remains larger or fuller is the male breast. And gynecomastia reduction surgery can really change a man's life. Gynecomastia surgery can be covered by insurance. Usually it's more likely to have that covered in a younger patient, patient who's 16, 18 years old. It may be considered something developmental versus in that same patient who's 30 years old, the insurance company would say, well, you've lived with it this long, it must not be something developmental. Most of my patients who have a breast reduction surgery go home the same day. I'd say probably 80% of them. The reasons for someone to stay overnight would be if they had any other medical condition that we were worried about, breathing issues, heart issues. But really, my patients up to even 60 years old have gone home the same day. On average, breast reduction takes about 3 hours. Again, it depends on the type of breast reduction. It also depends on how large the breasts are. The larger the breasts are, the more time it takes. It's kind of like tailoring a suit. So the larger the suit, the more sewing that has to happen. There are advantages to doing breast reduction surgery at a hospital-based surgical center or at the hospital itself. If a patient has a medical emergency, obviously the emergency care team is right there. We have all the necessary equipment necessary to in case of emergency. The other nice thing is if a patient really needs to spend the night, if the patient has more pain than you expect, more nausea than you'd expect, has blood pressure issues after surgery, patient can spend the night after surgery without having to go through an emergency room somewhere else. On average, I estimate about 3 weeks. The most of the recovery is due to soreness. If you're even on something simple as on a computer, you might feel soreness just lifting the arms up. The other issue involved in recovery is actually just getting energy back. The way I explain this to patients is that when you get the flu, your body's recovering from the flu for the next 2 weeks and you don't feel like you have any energy. Well, here your energy is being diverted toward healing all the things that we had to cut and sew together. And so often, it's another 2-3 weeks really to get your energy back.